Hello my friends, your family of Dr. AP. Today I'll teach you the topic about osteoarthritis, very common in the whole world. First see the following scene. Yes my friends, you all saw in the movie the way Govinda takes the bamboo stick and he walks. This is a very good treatment for osteoarthritis. If everyone in the world they take this bamboo stick after the age of 50 years, my friends, believe my words, osteoarthritis will almost be invisible. It will go out. Very minimum cases will be there of osteoarthritis. But here people are ashamed. They feel embarrassed. No, I'll not take. I'm not an old man. I'm not an old woman. People will laugh on me. This is a very common sentence from every human being. But you all are ready to suffer. What else the doctor will give? Tell me. A doctor will give you painkiller, calcium tablets, vitamin D tablets. Is it really the treatment? No. Then later on public, they think no. Now we'll do some Ayurvedic, some homeopathic, some Unani, and I'll get cured. Osteoarthritis is not a disease that it will get cured. It is a disorder, age-related degenerative disorder. The synovial fluid gets less degenerated according to age, and then there's degeneration, wear and tear, a simple osteoarthritis. People they really spend so much money. If you go to an orthopedic, you will see more than 50% cases will be there of only osteoarthritis. And what is the thing what a surgeon will recommend? He will recommend you knee replacement. I am totally against knee replacement unless and until the patient is debilitated. I mean, he or she is not able to walk properly. He or she is not able to do the daily routine of the day. Not able to walk at all, then go for knee replacement. But why? Why to go for knee replacement at an early age? Not required. Go for physiotherapy and use this bamboo stick. I mean, believe me, use this stick. In olden days, Mahatma Gandhi, he used to walk with the bamboo stick, and he was fit. You can walk a lot if you use this bamboo stick. One more thing. Don't use this stick, this one. Then this is wrong. Use only this bamboo stick. Strong, straight. You will walk fast. And if you keep on walking, you lose weight and automatically the osteoarthritis will not progress. So this is a progressive disease, degenerative disorder. So my friends, it's a message to the whole world. Use this stick after the age of 50 years and get prevented from getting osteoarthritis. People should understand this message. Believe me, it will be very tough for the orthopedics, because that is a great bread and butter for them. Even they explain properly, but people are not ready to understand. If I become the very big minister of this world, I will do it compulsory for everyone. Because osteoarthritis is really painful, yeah. It really affects the day-to-day activities. Public are not able to walk. People are not able to walk properly. They get pain, severe pain sometimes. So my friends, simple. Painkiller only if the pain is not bearable. Do not continue to take painkillers every day. It will affect your kidneys. So the message to the whole world, after the age of 50 years, start carrying this bamboo stick, or else be ready for knee replacement, which I am not ready. Knee replacement should be done at a later age. And if you take this bamboo stick, it will also help you to walk a lot. You will get prevented from diabetes, from blood pressure, from heart disease. Because if you really walk a lot, 4 to 5 kilometers every day, my God, all other disease will vanish. Very nice. This is very useful, the bamboo stick. This will maintain your health and will prevent from the progress of osteoarthritis. Please understand the message, my friends. If anyone in your house, if you really understand the message, start carrying bamboo stick. Don't get ashamed. Don't get embarrassed. It's your life and your life is in your hands. Please follow the message of your family doctor. Next time I'll bring some other topic with some other scene. Till then, it's a goodbye from Dr. AP. Thank you very much. Namaskar.